Any more questions?
I do have a comment. I know I talked a lot.
Let me get this young lady right here.
I just have a question. In 14, I was diagnosed with breast cancer, and August the 8th was 5 years clean. I didn't have it anymore, and they told me that in October I could stop taking the cancer pill, and I went through 34 treatments of radiation. I didn't have to do chemo because it was a 1A. It was so small. But I'm just wondering would it have been safer for me to do the MAMMAPRINT than to go through the radiation?
My understanding of MAMMAPRINT, it's called genomic testing, where it looks at the specific gene makeup of the cancer. So it's not testing your genes, it's testing the cancer genes. And what MAMMAPRINT and the first test that was out there is called ONCOTYPE, and there are a couple of others out there, but ONCOTYPE is the gold standard and MAMMAPRINT is a close second. So when they use MAMMAPRINT, they use it to determine how likely is it that your cancer is going to come back. And then on top of it, they use it to determine, is chemotherapy going to help you? Okay, so it would only address the issue of chemotherapy. We don't at this point have the radiation answer by genomic testing, unless you have a type of breast cancer called ductal carcinoma in situ. And then Oncotype does offer a test for that. One thing I would like to mention, you need to speak to your doctor because the current trend, unless they do an additional study, is actually to continue that hormone blocking pill for a total of 10 years. There is a study you can do called Breast Cancer Index, which is another type of genomic test that will help determine should you take this medication for just the 5 years or should it be extended out another 5 for a total of 10 years.
Okay, also, there's certain types of cancer, as she said. I had invasive carcinoma, and I had bilateral mastectomy. So in order so that not even one cell would go over to the other side, after doing that and reconstruction, that was when I had the MAMMAPRINT, because unfortunately, UT Southwest wanted me to do some other things that I did not want to do. But it is specific cancer, and it, as I said, stage 1 or 2 that qualifies for.
And just to follow up, I always explain to my patients, when you're talking about treating breast cancer, usually the first step is surgery, and there are 2 arms to that. Lumpectomy, and if you do a lumpectomy, because when you're treating breast cancer, you have to treat the whole breast. When you do a lumpectomy, all you're doing is removing the cancer, so you haven't treated the whole breast. You add radiation in, okay? The other option to treat the whole breast is remove the whole breast with a mastectomy. Those 2 options are actually basically equal, but unless you are over 70 and you do a lumpectomy, you can't skip the radiation unless you do that Oncotype test for DCIS.